In this video, I'll talk about two important biochemical parameters that are measured in blood in order to assess the function of the kidney. These two parameters are blood urea and creatinine. Blood urea, blood urea is synthesized in the liver from the ammonia produced in the intestinal tract as a byproduct for the digestion of protein. So ammonia produced in the intestinal tract is transported to the liver and then converted into urea. The urea is excreted through the kidney. So this is why blood urea is used as a test for the function of the kidney. The second parameter is the creatinine. Creatinine is a metabolic product produced from the muscle. First, creatine is synthesized in the liver and then transported to the muscle, combined with phosphorus and result in the formation of phosphocreatine. And then when the body needs energy, the phosphorus is used for synthesis of ATP, and the phospho and creatine is converted into creatinine. The creatinine produced from the muscle is excreted only through the kidney. So here these two parameters excreted through the kidney, and this is why used to assess the function of the kidney. However, urea is considered sensitive for renal diseases, but not specific. Creatinine is considered specific, but not sensitive. So the presence of mild renal diseases will result in increase the level of urea in the blood. Why urea is considered non-specific for renal diseases? This because urea is affected by the level of protein produced in the intestinal tract. When large amount of protein produced, this means that more ammonia is produced and transported to the liver, and will result in increase the level of urea, which is not related to a disease in the kidney. Also, in presence of abnormalities in protein metabolism, will result in reduction in the production of ammonia and will affect the level of urea in the blood. Also, the presence of disease in the liver will affect the production of urea and may result in reduction in the level of urea in the blood. Also, another factor affecting the level of urea in the blood is dehydration. Urea increased in the blood circulation in cases of dehydration or hemoconcentration. So cases associated with diarrhea or vomiting or any other causes of dehydration will result in elevation of urea level in the blood. So renal diseases is not the only cause for elevation of urea. However, if we excluded other causes that result in elevation of urea, the kidney will be the cause at that time. So urea is considered sensitive. It increased in mild renal diseases, but urea is not specific because there are other factors that affect the level of urea in the blood. Regarding creatinine produced in muscles. However, creatinine excreted only through the kidney. Creatinine is not affected by the diet. Creatinine is not increased in cases of dehydration. So creatinine is specific for kidney diseases, but it increased in late renal diseases, not like urea. So it is specific. Once creatinine increased, the renal disease is confirmed. Also, usually, increase of creatinine is associated with elevation of blood urea. However, elevation of blood urea is not essentially associated with elevation of creatinine level in the blood. Creatinine level in the blood can decrease in cases of wasting of, in cases of emaciation, or wasting of muscles due to the decreased muscle mass will result in decrease the production of creatinine and affect the level of creatinine in the blood. So creatinine level can be decreased in cases of liver diseases or in cases of wasting condition or decrease the muscle mass and the body muscular structure of the body. But creatinine, as we said before, is considered specific for kidney diseases. However, urea is sensitive and not specific. In conclusion, both urea and creatinine is used to test the function of the liver. Creatinine is specific but not sensitive. Urea is sensitive but not specific. The elevation of creatinine in the blood is usually associated with elevation of urea. However, elevation of blood urea is not essentially associated with elevation of blood creatinine level.